My name is Brody Maack, and I am Vice Chair and Associate Professor of Practice at the North Dakota State University School of Pharmacy. And I also spend half the week at a practice site in ambulatory care at Family Healthcare Clinic, which is a federally qualified health center. I completed my Doctor of Pharmacy degree at North Dakota State University, and after graduating I completed a PGY1 residency at Lake Region Healthcare in Fergus Falls, Minnesota. After that I went on to practice a little bit in the emergency room setting and eventually transitioned into the ambulatory care setting where I practice now. The reason I really chose pharmacy was I knew that I wanted to go into a medical profession at the time when I was choosing my college degree, but I wasn't quite sure exactly which medical profession I wanted. And so it was a little bit of luck that NDSU had a pharmacy program that I looked into, and the faculty there were able to kind of show me what pharmacy was all about. And I really appreciated the fact that pharmacists are really heavily involved in kind of a team-based approach and kind of put the patients first. And so that's really why I chose to go into pharmacy. So at Family Healthcare, we're a federally qualified health center. And we're also, so it sort of operates like a family medicine clinic. And so my typical day is I'll come in and I'm in an office-based practice. So I practice along with our physicians and nurse practitioners, sort of operating as a physician extender. And so I come in, I have a schedule of patients just like our colleague providers do, and those patients have typically been referred to me from those physicians and NPs just to give kind of an extra focus on comprehensive medication management. So I may be seeing patients face to face, I might be doing some phone visits or telehealth visits, but really my focus is to work with patients achieving their health outcomes and kind of health goals, and with the process of comprehensive med management. And then within that process, I have a collaborative practice agreement, so I'm able to prescribe medications, change doses, discontinue meds, order lab and diagnostic work. And so it really kind of operates as an extension of the physician and NP team, kind of in a team-based approach. My favorite part of my job is pretty easy. Actually, it's twofold. I think the first part and my most favorite part is just the relationships I build with my patients. And so being in ambulatory care, you know, when a patient is referred to me and I see them for the first time, my hope is that I see them and I'm a part of their healthcare team for the rest of their life. And so getting to know the patient, their family, their friends, oftentimes we have a whole family team that comes in with the patient to visit with me, and so it's really fun to get to know them and build those long-lasting relationships. The secondary kind of part 1B of my favorite part of my job is really working as an integral part of the healthcare team and really being, you know, really kind of on the same playing field as our physician and nurse practitioner and physician associate colleagues, and we recognize each other as really a team, and so it's a really fun practice setting that way. This day and age, a lot of the public and people that don't know much about pharmacy kind of have their own perceptions of what a pharmacist does, and so I would encourage people that might be interested or maybe not even know much about pharmacy to really reach out to a pharmacist, ask if maybe you can shadow that pharmacist to see what they do on a daily basis. The other thing I'm seeing is if you reach out to a local school of pharmacy, there's a lot of resources that they offer as far as, you know, shadowing experiences, you know, taking people into what it's like in the day of the life of a pharmacist. Because I think what we see on commercials on TV often is somebody standing behind a counter dispensing medications, but we as pharmacists know there's so much more to the job than that. And so I think my advice would be just, you know, dig into finding out what we really do on a day-to-day basis, and you'll find out that it's a lot more than just dispensing medications.